Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
All right, let's talk about the PREVENT calculator. Now, this is newer in the armamentarium of trying to determine basically should a patient get statin and what kind of risks they are for having a coronary event, stroke. I love the name of this, PREVENT. Look at this. The cardiologists always get this right. P from prevent, and then risk of cardiovascular disease events. Now, the ASCVD calculator, which is still in use, was developed in 2013 by the American College of Cardiology and American Heart Association. The variables on the calculator: age, sex, race, blood pressure, total HDL cholesterol, history of smoking, diabetes, and treatment of hypertension. Now, the problem with that calculator is that a lot of people felt that it caused more people to take statins than they should have. And that was the big discussion then. Now, there are some differences in the PREVENT calculator from the ASCVD, the data, 3.3 million people versus 25,000 people on the old calculator. The new calculator includes BMI, GFR, hemoglobin A1C, and you can omit some of these. Urinary albumin to creatinine ratio. It omits race, but you can put in the zip code if you choose to, and that zip code will show if people are in an area where it does not have as much resources as others. Gives the estimate for cardiovascular disease overall, heart failure, coronary disease, plus stroke. So it gives more information. Now, the risk estimates were lower with PREVENT than they were with the older calculator. It's very easy to access. You can go right to as a Google search, and you can get it right here. Here's a link if you need to get it. So in the validation studies, it showed lower risk in patients. An example would be the old calculator predicted risk was 8% versus 4.3% with PREVENT. So much lower risk in the PREVENT calculator. Now, nothing in medicine is easy. And now the feedback is coming, and it's from a lot of people are saying that it's too low of a risk. So they're not recommending using it. And then they're using like a hybrid of the old calculator with this calculator. So this is one of those things we're going to have to kind of see how it validates over time with anything in medicine. So they've put a lot of data in this. They've done a lot of work. They actually combine the kidney function. They've worked with adding with kidney function into this to give it more data, to give it more results. But the pushback is saying this is giving low risk versus the old calculator, and there's going to cause people to mainly take less statins. So let's see how this plays out in the long term.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.